Just one new local case today, and it's not linked to the Tan Tock Seng Hospital cluster.
Preschools and early intervention centres will tighten entry restrictions from Saturday, including a ban on almost all parents.
And we break down what you need to know ahead of TRACETOGETHER-ONLY check-ins from May 17th.
Welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
And I'm Harianto Diman. You can subscribe to the Straits Times channel so you never miss a single episode. One COVID-19 community case was reported today. Now, the Health Ministry said it's not linked to the cluster at Tan Tock Seng Hospital.
Today's other 15 cases were imported and placed on stay-home notice when they arrived. More details will be released later tonight.
Several nursing homes like Peace Haven Nursing Home and Lee Ah Moy Old Age Home are turning away visitors who had recently been to Tan Tock Seng Hospital. Some have also implemented additional measures like segregating and swabbing residents who had been to TTSH inpatient wards in the past 14 days.
This comes after an elderly patient who was first admitted to TTSH tested positive a day after being discharged to a nursing home.
Meanwhile, from this Saturday to May 30th, there will be more restrictions at preschools and early intervention centres.
For instance, parents will not be allowed to enter these centres except for those with newly enrolled children. Children from different classes will also not be allowed to intermingle.
While outdoor activities during this period may continue in groups of 5 children, large-scale ones like learning journeys and field trips will be postponed for now.
Well, these tightened rules at preschool centres follow a slew of other measures announced last night.
To recap, people will only be allowed to gather in groups of 5, down from 8 currently. This will apply to households as well, which can only receive 5 distinct visitors a day.
For workplace rules, no more than 50% of employees can return to the office, particularly if they're able to work from home. Social gatherings at the office should be avoided as well.
And indoor gyms and fitness or health studios will be shut as they are considered higher risk settings. But outdoor exercise classes may still continue with a limit of 30 people and with safe distancing measures in place.
Well, joining us now is Professor Dale Fisher, a senior infectious diseases consultant from the National University Hospital.
He also chairs the National Infection Prevention and Control Committee. Welcome back, Professor. As Minister Lawrence Wong said last night, these measures will bring us back to phase 2. Now, sentiments on the ground range from some saying these curbs too strict, all the way to those calling for another circuit breaker. Where do you stand on this spectrum?
Actually, Harianto, there's no one better to make these decisions actually than those people doing the investigations. So MOH has teams of experts that have been doing this for way before the pandemic, actually, for other infectious diseases. But they're really very experienced now. They can see all the data. They can look at the cases. They can do the contact tracing. They can see the hotspots. They can see if there's a big chance of cases being missed. So I think it's we're well entitled to trust the system in this case. Remember, a circuit breaker to go all the way, that really means you've lost control. That really means that it's run away from you, and you say, look, the only way we can get this under control is if everybody really goes home. We put in really extreme social measures because we're not sure where the virus is. We have a lot more capacity still than having to go to that extreme, I think. I'm not saying we won't get there. I certainly hope we don't get there, but I think a circuit breaker would be premature at this stage. I think there's a good chance that all the public health systems in place will do the job that they're designed for and what they've been practicing to do. Of course, bringing in some more stringent society measures is like an added layer of protection, if you like, saying, just in case anyone slips through our net, it would still be good if we had smaller crowds and things like that. So So I'm fully supportive actually of the stance at the moment.
Right. Well, we're not at a situation where the circuit breaker has to be reintroduced, but one of the biggest curbs that will be reintroduced from May 8th is the closing of indoor gyms and fitness studios. Prof, gyms weren't closed during phase 2 last year, so what do you make of the reimposition of these gym closures? Because, we haven't seen an outbreak at any gym so far.
Well, I must say I don't know the detail, but nor for that matter why they weren't part of phase 2 before. But nonetheless, if you think about them, they're often small rooms, significant numbers of people. There's a lot of people not wearing masks. There's a lot of deep breathing because of the exertion with doing the physical exercise. So I can see why they're a sort of a high risk setting. So without knowing the sort of specifics of whether there is a particular concern there, it certainly makes sense, and it has been practiced in many other countries that gyms, unfortunately, are quite early to go, in a way like nightclubs for the same sort of reasons.
Hospitals have been asked, Professor, to defer non-urgent surgeries and admissions, as well as non-urgent specialized outpatient clinic appointments. Now, for viewers who may have upcoming appointments at the hospitals, perhaps you could help them understand what is urgent and what is not.
Yeah, so the Tan Tock Seng outbreak is certainly the most challenging cluster at the moment, with 40 people to date, and there will probably be more that get diagnosed, but hopefully in quarantine going forward. That's obviously having an impact on other hospitals because to limit what Tan Tock Seng can do means that more healthcare has to be provided at other places. So naturally, the non-urgent stuff needs to be displaced. So we continue to look after the sickest people and the urgent things. It really would be a tragedy if someone suffered health-wise because we're all worried about COVID, but they went on and had a heart attack. So things like cardiology, many of those appointments will be urgent and not the sort of things you want to put off. I think things like obstetrics, that time clock is still going, cancer care. Many of these types of specialties are less able to defer. I think you'll find most people actually know what's a routine appointment and what can actually be put back a couple of weeks versus what needs to be sought out because there's a current issue. So if there's any doubt, the hospitals will certainly be contacting people and suggesting deferring. We certainly want to get a lot of those appointments and elective admissions and elective surgeries all deferred for a few weeks until we sort of restore the natural order. And don't forget, there's been a lot of systems set up through the course of the pandemic, such as telemedicine and delivering of medications and things like this. So you can kind of still have your appointment without going to hospital in many respects as well.
Right. Well, we learned yesterday that 5 cases in the Tan Tock Seng hospital cluster were found with a sublineage of the India variant, including the nurse who was the first detected case in the cluster. So, Professor, of course, virus variant should be studied in academic circles, but why is it important for the layperson like Haryanto and myself, to know which cases are infected with which virus type?
I've got a feeling you and Haryanto really want to know which variants they are. No, actually, there are some practical importance to this as well. Firstly, whole genome sequencing is done to see if the clusters are all the same type. That really confirms, we might say that a cluster is all epidemiologically linked, but that also means that they should be the same strain. So it's important in that regard to give that scientific backup to the sort of epidemiologic investigations. The other thing, I think, when it's these new variants that have emerged, and as was also made public, that that there's the English variant, the South African variant, the Brazilian variant, as well as the Indian ones, are all involved in these current clusters. That also tells us that these clusters are generally unlinked. So that also tells us that we need to really hone in on how each of these clusters started, because they've come from separate origins. I think it also tells the public that we are dealing with something that's different to a year ago. These are more slippery viruses, if you like. They things we did last year to prevent spread might have worked with a less transmissible virus, but now with these more transmissible ones, we just have to be that much more meticulous and careful with all our efforts, because if you've got something that's more transmissible, then it's less forgiving if you don't do everything that we know to do and do it really well.
Well, great points there. Thank you so much for putting them across on the show, Professor. We've been speaking with Professor Dale Fisher, Senior Infectious Diseases Consultant at NUH.
From May 17th, Trace Together will be the only form of check-ins at places with higher footfall, including shopping malls, offices, schools, places of worship, F&B outlets, and gyms. Now, this was supposed to happen on June 1st, but it's been brought forward by 2 weeks.
So also from May 17th, other modes of safe entry check-in like scanning a QR code with a phone camera or the SingPass app will be discontinued. Well, if you're still unsure of how you can check in, the Straits Times' tech editor Irene Tham is here to make it easy for you to understand the new rules. Hi Irene. So come May the 17th, what are the different methods of checking in?
Hi, there will be 3 ways to check in. And all these 3 ways will involve the use of the Trace Together token or app. We call it TT for short. First, you can scan the QR code on your token at the venue. You can also, current scanners deployed at venues will still work for this purpose. Second, you can activate the TT app on your phone and use the built-in scanner, QR code scanner, to scan the safe entry QR code that's already deployed at many venues. And the third way you can check in is to place your TT token or your smartphone with the TT app near safe entry gateway readers, which are being rolled out across all major venues where people tend to linger and spend a bit longer time together. So if you want to do that, the third method, make sure that you turn on the Bluetooth function in your phones to allow the safe entry gateway reader to sense your TT app. You may also call up the TT app if the app doesn't appear to work in the background. So you may need to just go and click on the app, turn it on, and then put your phone close to the gateway reader.
Irene, Trace Together works based on Bluetooth proximity data. So when a COVID-19 patient uploads that data to MOH, it's processed and filtered according to duration and signal strength to identify only the close contacts. In that case, why do we need to check in at any venue when it's the person-to-person Bluetooth exchanges that are more important in contact tracing?
Right. Well, you're thinking the same way as all of us. I mean, we all think that, if you can do transmission chain tracking this way, why do you need to, just scan the QR code, right? Well, TT gives you an idea of who had been in close contact with whom, and then you can actually map the chain of transmission from person to person, who passed on the virus to whom. And but TT does not contain location data. So people actually need to check into venues to log their location. This information is important to identify where the COVID-19 clusters are, and so that venue operators can take the necessary action like sanitization, and then policymakers can also make the necessary policy changes, safe management rule changes, and whatever that's needed to contain the infection. So it is important to check in because TT, the app itself, for privacy reason, does not log people's location data.
Well, thank you so much for shedding more light on this, Irene. That was our tech editor, Irene Tham.
And remember, checking in with Trace Together will be compulsory from May the 17th.
A quick check on some global headlines. Having already cut off mobile internet access, Myanmar's military-controlled media has now banned satellite television receivers, saying outside broadcasts threatened national security. Anyone caught violating the measure will be punished with 1 year in jail and a fine.
Those in Britain who are over 50 years old will be offered a third COVID-19 vaccination jab in a few months. According to The Times, trials of two options are underway. One involves vaccines specifically modified to tackle new variants, while the other is an additional shot of one of the three vaccines already in use, which are Pfizer, Moderna and AstraZeneca's.
The world's oldest person, 118-year-old Kane Tanaka, has pulled out of the Tokyo Olympics torch relay over pandemic fears. As at Sunday, 8 people involved in the relay have been diagnosed with COVID-19.
Well, those are our top stories for today. For more news and videos, visit straitstimes.com and subscribe to our YouTube channel by hitting the red button below.
Once again, I'm Haryanto Diman with Olivia Quay. Join us tomorrow for more stories on A Big Story.